Food testing. So what we like to do is when people go plant-based, there's a tendency that people can go plant-based and then their symptoms get worse. I was doing, I'm smoothing, I'm having salads, I'm eating all these sprouts, I'm eating foods and avocados, and all of a sudden my joints got worse. I got diarrhea, I got gas and bloating. It's not just the fiber increase. Now we're looking at as food sensitivities. We want to look at now taking an individual and saying, here's your level of data. The data shows that we should be eating plant-based. No more end of discussion, end of argument. The science is there, that's what it proves. However, we need to look at each individual. Do you have a sensitivity? There's two types of sensitivities. One that you can eat a food within an hour have a reaction. Mine was very serious. My peanut reaction was very serious. That's within a few seconds. 2% of the population have that anaphylaxis. 98% of the people can have an immediate reaction that's not life-threatening. So you can eat something and just have heartburn, reflux, diarrhea, constipation, headache, back pain, whatever it is. It's just not life-threatening. Okay? That's one type of reaction. The second type of reaction happens a few hours up to 4 days later after consuming it. So today is Saturday. Okay? So Saturday, so somebody can have something on Thursday and today have a flare of whatever their itis is, or Friday. So these are things that stack, and eventually you tip the point of function and dysfunction point. I explain this in detail, but this is key because we want to then look at, people can have a sensitivity to kale or blueberries or some of these wonderful things that we consider a superfood or here's a super supplement, but if you take it, you can actually get worse. So we like to then individualize and then specialize what is the most anti-inflammatory diet for you. We look at nutrient testing. So it's not saying eat more foods that have this. It's actually looking at what are you absorbing. People take supplements all the time. People eat a whole food, plant-based diet. I got people like, I do all these smoothies. Fine. Well, let's test it. Put it to the test, as Dr. Grieger will say. It's like, is your levels up to par? So when we measure that, because here's the thing. Supplements supplement the diet. They don't replace the diet. And everybody wants to replace the diet with supplements. I use supplements all the time, but it's targeted. So if there's a deficiency, the nice thing about the testing that we do is it will tell us how much you need, and more importantly, what foods they're heavily found in. So you can eat a lot more of those things, and you get all the rounded of all the benefits of getting for food. If there's a true deficiency and it's hard to eat, then that's when supplementation can be a game changer. We look at the patient's microbiome. We want to look at, how is your digestive function? How is your digestive enzymes? Are you breaking? Because some people have really, really low digestive enzymes. So how can they eat a raw diet? Like, I can't do it. Right? It's just I get so much gas and bloating. I can't break down the food. We want to look at, are you eating enough protein? Are you eating enough fats? Are you absorbing it? Is there inflammation in the bowel? Do you have small intestinal bacterial overgrowth, SIBO, or candida overgrowth, or yeast overgrowth, or parasites? But the idea is when we test for this individually, it's not just treating patients on symptoms, because most people will go to a GI doctor, you have SIBO, here's an antibiotic, costs $2,500, and they'll blow out your gut. But it's safe. And then you'll have natural therapists who will say, it sounds like you have candida or a parasite. Here's a parasite product. But what people don't realize is that all these products not only knock out the bad guys, they also knock out the good guys. And antimicrobial is antimicrobial. Whether it's garlic, whether it's oregano, whether it's berberine, whether it's golden seal, these all have antimicrobial effects of doing good things, but they also knock out the good guys. So when people say, I take this product to prevent it, you shouldn't be taking any kind of product for antimicrobial for prevention. That's a treatment option. Right? So a lot of people are like, I wouldn't take amoxicillin for forever, so why would you take that product forever? Because they don't understand plant and herbal medicine. So this is a disconnect where people now can treat something initially, safely and naturally, and then actually spin them out into dysfunction, and just like as if someone was taking too much antibiotics. So we also will check about leaky gut, and this will be explained in my book. So anybody that has IBS, or anybody has heartburn, reflux, diarrhea, constipation, the book will go into detail. Anybody who's taking the purple pill or any of those kind of things, it will be heavily discussed. Eat a whole food plant-based diet, and start off with just getting tested, and we can help people like that. But we want to start with eating 3 additional fruits and vegetables a day. That's 30% risk reduction. 6 is 60, 9 is 9. That's why the USDA will say eat 9 servings a day, right? If you need to put it in a smoothie, if you need to eat it in a bowl, it's fine by me. You need to just get it into the body as much as you can. I'm not a purist. I'm a realist. So realistically, any movement in the right direction is a good move to begin with. Now, switching the subject. Okay, now, ta-da! Black box warning. Okay, so this is my soapbox. I thought of all this other stuff. It's like, okay, if you don't understand eating plants now, you should. By the end of the conference, everybody's going to be growing a garden on some level. So, good. Black box warning. What's a black box warning? Okay, so this is something that everybody should know. And this is what I've become well known to talk about because we're looking at the black box warning. Every drug that you get on the market, it may have a black box warning or it may not. What a black box warning is the following. When you look at the monograph of a drug, any drug that you take, whether it's over-the-counter or by prescription, it will have something what they call common side effects and serious side effects, okay? So common side effects, for example, taking ibuprofen or Motrin or Advil is just like diarrhea, constipation, heartburn, reflux, ringing in the ears, swelling of the ankles, okay? Maybe rash, okay? Not life-threatening, won't die from it, but maybe not so comforting, right? Then there's serious reactions, and serious reactions mean something that can cause a heart attack or a stroke or a GI bleed, okay, or some cancer of some kind. Those are rare, so rare things occur rarely, common things occur commonly. However, if a product has a problem that's serious, that then starts to occur commonly, then the FDA puts out what they call a black box warning, which means you can end up in the black box. Now, I like this cartoon. It says FDA-approved drug, and it says warning contains FDA-approved drug. Because that's really what it's at. What happens is this. Once you get that little package or bottle, and you tear open that package. So right now, if I went to the gift shop right here, say, oh, my back hurts, my feet are killing me, let me take an ibuprofen, or let me take any kind of non-steroidal anti-inflammatory right now. If I tear open that package, or I open the bottle, I've already accepted the terms and conditions that this can happen. The black box can happen, and there's no legal recourse that you can take against the manufacturer. So when we think of NSAIDs, non-steroidal anti-inflammatories, this is what 1/3 of Americans take daily, 30 different types of prescriptions, right? So it's not just ibuprofen is Motrin and Advil; those are brand names. But you can go to get Walprofen, Cevus. There's tons of generics of those, right? And we think of naproxen as Aleve, and we think of celecoxib as Celebrex. But these all have black box warnings, right? So one of the things that people have to understand is that when we look at the data, lifestyle, heart disease is number one in killing people. I mentioned that earlier. Cancer, stroke. But when we actually look at other data saying what is still killing Americans even more than heart disease, that's not lifestyle, it's not terrorism, it's not anything else that we should worry about. It's actually medical errors and side effects. Kill more people than heart disease, than cancer, and stroke combined. So my book will cover this data because this is something, when people say, oh, well, people die of heart disease. Yeah, but people are now dying more of drug interactions, side effects, and medical errors in our system than actually the diseases that we're trying to treat with those medications. Now, all the NSAIDs have black box warnings. So you can have a heart attack, a stroke, or a GI bleed at any time taking just one of them. So we used to think, oh my God, you have to take tons of ibuprofen or tons of Aleve to have a heart attack or stroke or GI bleed. No, you can say, I just have, have menstrual cramps once a month. I just take this for my period pain. Or I have back pain or my feet today. I'm going into a lecture just once a month, okay, so I'm going to take one of these things. I can take that and I can have a heart attack even if I eat plant-based and my vessels are clear. If you have any comorbid conditions like obesity, diabetes, heart disease, blood pressure problems, your risk is higher. If you have any problems like, oh, I take an acid blocker or a purple pill or have IBS, your risk for a GI bleed or intestinal perforation is higher, right? But we don't count these in the data because this is not the cause of death. We will say, oh, well, they were under stress or they already had heart disease. So this is contributing to why we're having more people have these things. So what we want to look at is there something natural that we can give that's anti-inflammatory, that's safe, natural, clinically effective, and yes. And so this drove me not only to research what is causing our inflammation from the food in our diet, but it's also what can we give that's not a non-steroidal anti-inflammatory, because in my opinion, it's not correct for a lifestyle physician or a plant-based doctor to be like, okay, let's eat more plants, and then, oh, you have a pain problem, take ibuprofen. That to me is just as a disconnect. Because food is medicine, and there's plant medicines that come from plants that we should be using instead of just using pharmaceuticals that might have side effects, okay? I'm not anti-drug, by the way. I'm not anti-pharma. I'm just pro-patient, pro-safety, pro-data. And if the data shows that something is not as good as they proclaim it or market to, then I will look at what is safer, what is more efficacious, and what's more affordable.